Hello, everyone. Welcome to another session of Food Facts Decoded, Myths Busted and Facts Served. I'm your host and host, Sheryl Salis, a registered dietitian, certified diabetes educator, founder of Nurture Health Solutions, and campaign against nutrition quacks and courses. In today's session, we will be discussing about gut health, the power of prebiotics and probiotics. Our gut is often called our second brain, and for a good reason. It plays a vital role not just in digestion, but in immunity, to elevate one's mood, in mental health, and for overall well being. Today's session will take us through the fascinating science behind gut microbiota, the benefits of pre and probiotics, symbiotics, and postbiotics, and how we can make informed choices to support our digestive health in day to day life. There are so many myths and misconceptions around pre and probiotics. And to dispel these myths and get our facts right, we are honored to have with us a passionate expert with a brilliant mind. Will give us evidence-based scientific facts, dispel the myths, and share practical tips that can make a real difference. It is my pleasure and honor to introduce Dr. Rohini Sharma, my friend and an eminent expert in the field of nutrition and food technology. Dr. Rohini is a freelance consultant food technologist and nutritionist with over 20 years of combined experience in the field of food technology and nutrition and dietetics. She holds a doctorate in nutrition and stress management from Avinash Lingam University, Coimbatore, master's in food technology with distinction from CFTRI, Mysore, and she's graduated in food technology from Delhi University. She also holds a PG diploma in psychological counseling, gold medalist, and she's also scored the first rank in public relations. So you can imagine we have such a brilliant mind with us. She has been a guest faculty in several prestigious institutions and has worked in Coca-Cola in the field of quality, in Ganga Hospital, Coimbatore as a chief clinical nutritionist, and as an associate professor in PSG College of Arts and Science, Coimbatore. So we welcome Dr. Rohini.
Good afternoon.
Such a pleasure having you, Dr. Rohini. Such a pleasure. I was just reading your CV and must say it's such a honor and a privilege to do this session with you. And as I said, a passionate person with such a bright mind. And I think it'll be so wonderful to understand this whole, thing on gut health and pre and probiotics, because so many myths and misconceptions around it. I think today everybody in their prescription, even if it's a lay person, is now taking and popping in, probiotics, and there's a lot of confusion out there. So I think let's just straight dive in, and we'll do this in 3 sections. So the first section will be understanding the gut microbiota and impact on health. So my first question to you is, what is gut microbiota? Because everyone's talking about it. So let's understand what is gut microbiota.
Yes. So we are all looking for balance on the outside. We are trying to balance our stress, balance our diet, but we need to look within, because inside our body and in the gut, there is a whole universe of microorganisms that are actually extremely vital for maintaining our health, our state of mind, our nutrition, and also our gut integrity. So there are about a trillion, hundreds of trillions of microorganisms which are very synergistically and harmoniously living in our gut. And this is known as the gut microbiota. And when they are in
same, and is it different for different people? I mean, when we're talking about microorganisms, so does it differ from every individual?
Yes, it is extremely unique, and it is based on various factors such as, your race, your ethnicity, which part of the world you're living in, which, even a state would matter, urban and rural differences can matter, then your birth, right from birth, when you are born, the way you are born, whether it is by natural birth or whether you're born by cesarean section, will determine the first introduction of microorganisms from your mother's birth canal. Then the kind of feeding you got, whether you were breastfed or you had feeding by a formula with a bottle, that is one. Then as you grow, your gut microbiota keeps changing with age. as a young child, a toddler, a youth, and with age, again, it changes. As you're older, it drastically changes. Then the most important one is the diet. Okay, so we what diet we are eating, because it is extremely selective and unique within a family. Also, you will have people, with various kinds of diets, preferences, and so that really impacts your gut microbiota. The other important aspect is stress. Okay, so what is your exercise routine? Are you getting enough sleep? Are you dealing with a lot of stress? So all this also impacts your gut microbiota. And the other important thing is, if you're taking any medications, so they can interact very in a very impactful manner with your gut microbiota. We all understand that when we take my antibiotics, it does not select and kill your pathogenic microorganisms. It basically wipes out a large amount of your very healthy microbiota that you need it as well. So you must be aware, and people are now also getting these from doctors. They get lactic acid bacteria, in lyophilized forms, to populate the gut, and people are told to consume probiotic rich foods in the
Right.
home to replenish that bacteria. So these are all the processes which determine your gut microbiota, and it's almost like a fingerprint. Nobody has the same kind of gut microbiota.
That's the beauty, right? How each one of us is so unique, and it's not a one size fits all. I think that is something that we keep telling everybody, that it cannot be a one size fits all.
Yes. Yes.
And I mean, very interesting that, people in different states also will have a different gut microbiota. But what if I move and migrate from one state to another, or maybe from one country to another? Does it
Yes.
change over a period of time?
Yes, if you move from here, say you move to a country like the US, or you move from North India to South India, your food habits are going to change. Your weather is going to change, and whether you go on to a healthier diet or you go to a less healthier diet will also determine your gut microbiota.
Correct. Because that's what we say. We have a lot of people who say, okay, I could, digest this food when I was maybe in Mumbai, but now I've moved
Yeah.
to Kolkata and I'm not able to. Suddenly
Yeah.
this food is not suiting me. I feel bloated. I feel
Yeah.
gassy all the time. And, I'm not feeling comfortable. So I think
Yeah. And
that's
again, the food grown in a certain area can also be impacted by the kind of microbiome of the environment. So
right.
we are looking at microbiota of the body, but the food is getting
Soil.
produced in the soil, the animals that are producing it, their gut microbiology and the environment. It's a very complex system, and everything matters and it comes into play.
It's wonderful. So, what is gut dysbiosis? We often hear and we often say gut dysbiosis, and that is where the need of, intervention comes in, or, introducing certain foods comes in. So, what is gut dysbiosis?
So we need to understand that there are about two major phyla of microorganisms. One is the formicutes and the other is the bacteroidetes. So these are kind of two major phyla. There are others as well, but these are the main ones which we can, assess and correct. So when there is an imbalance in these two phyla in a gut, then we will have symptoms. So you would be able to see changes in how you are feeling in terms of your digestion, your overall fatigue, your you can have brain fog, you can have increased stress response, lack of sleep. So all these things can be affected by the ratio of the firmicutes to the bacteroidetes. Now let me just tell you a little bit about what firmicutes are. Now, formicutes are, these gram-positive bacteria, usually the lactobacillus and streptococci and all these, which are responsible for your energy metabolism. Okay, then also for your fermentation. Okay, so in the gut, nutrient absorption, these are the major roles that these gram positive bacteria play, and they are associated with obesity. So if their levels are high, you will see obesity in people if there is an imbalance, that is. Okay, now the bacteroidetes are the gram negative bacteria, and they are associated with fermentation of these complex carbohydrates. So they produce those short chain fatty acids, which are important for your gut lining and integrity of the gut. So when you have an increase in these bacteroides, and they produce also lipopolysaccharides, which is a kind of defense mechanism which the bacteria has, and it elicits immune response in the human body. And it is good at certain levels because it modulates the immunoresponse. However, in excess, the body gets overwhelmed and you will have inflammation. And these bacteroides, then if there is too much of lipopolysaccharide, it causes the gut integrity to be lost, and you will have symptoms like diarrhea, irritable bowel syndrome, all these kind of issues with the prolonged chronic issues with the gut. So the what we do measure when you're trying to assess the gut health, you would take the F by B ratio, that is the Firmicutes bacteroides ratio, and you assess whether it is in balance. Dysbiosis will be either Firmicutes are high or bacteroides are high.
And
So
how
this is
does
what
one
I can do.
test that? I mean, how does one check
Yes.
that?
So there are several tests that can be done. And first one is, first you check for symptoms. So that would be the first trigger. You would go to a health practitioner, and they would ask you your lifestyle, your symptoms, and your diet and everything. And then try, and also maybe if you need to undergo tests, there can be a stool test that is done where the microorganisms are analyzed microscopically, and you will get an idea of the level of firmicutes and the bacteroides. And the FNB ratio will give you the level of the dysbiosis. Then also there is a urine test that can be done for your organic acids in the urine, which the bacteria are producing. So if they are reduced, you will know that your healthy microorganisms are depleting. Then there is also a breath analysis test where a sugary syrup is given and the person drinks it, and the hydrogen and methane levels are checked by a breath analyzer. So when they do that, again, if they are in excess, you will come to know that there is a dysbiosis, and metabolism is disrupted. There is also the option of biopsy of the gut in extreme cases, where they take a small bit of the gut and observe it microscopically, and get an understanding of what kind of bacteria are actually populating the gut. And it also gives you the idea of the gut integrity and what condition is the gut in. Stool test is one of the most reliable ones. Most common ones is your stool test.
And
Yes.
I think again, very important is that whenever people go, they should go to a qualified health professional, because
Yeah.
today everybody is, a health professional, so to say, even if they've
Yes.
gone through something and they would, think that they're qualified now to give advice. And everybody is
Okay.
now giving advice left, right, and center.
Yes,
So
and
I
also,
think
these test results have to be correlated with the symptoms. So,
absolutely
what symptoms did the patient present with initially? So, is it actually matching with this, or is it something else? So, only if there is a dysbiosis, you need the treatment,
right. So I think
right?
very
So,
well said. Like we say, anything in excess is not good, even if it's
yeah,
good. So, there
yeah,
has to be a good balance between the good and the bad, even
true.
in terms of the bacteria in your gut.
Yeah.
So how does one treat gut dysbiosis? How would one treat once you've
Okay,
diagnosed and
so
we said, okay, now there is a dysbiosis. So how does one treat it?
yes. So once you identify which are the microorganisms which are, imbalanced, so you would need to, A would be dietary intervention. So first of all, you would need to change your diet. If you're on a high fat diet, you will have larger amounts of lipopolysaccharides and higher inflammatory cytokines in your gut. So you would need to actually, cut down on the fat diet and more complex carbohydrates, more of fiber, fruits and vegetables, whole grains. Okay, that would be one. The other is to take some kind of supplements that can really help you with the
I think
introduction
we'll come to
yes,
that in the next
yes.
section. So I
And
just want
again,
to know about the
again,
lipopolysaccharides, because I'm
yeah,
sure people
yeah.
will be very intrigued to know what is
Yes.
the role in gut dysbiosis and disease, especially in
All right.
disease.
So when there is an overload of the pathogenic bacteria, they produce this lipopolysaccharide, which is like a slimy substance, which is supposed to protect them from other microorganisms. However, like I said, in small quantities, when there is a balance in the gut, there is no problem because it elicits a healthy immune response in the body, and the gut stays healthy. There is adequate amount of short chain fatty acids. The layer of mucin in the gut is intact and a good thick layer, so it protects the epithelial cells. However, when it comes to production of high amounts of lipopolysaccharide, the gut integrity is affected because it affects the short chain fatty acids, and it does not allow it to act on the body or the lumen of the gut. So you lose your mucosal layer, and tight junctions of the epithelial cells of the lumen would be lost. So you would have leaky gut, and you would have transmigration of this lipopolysaccharide into the circulation. And also bacteria, pathogenic bacteria can move into the circulation, and it can cause major inflammation in the body,
Correct.
and it will create a sort of, everything goes out of sync. Prolonged and chronic inflammation is the worst thing, rather than an acute infection. This is worse than that. So it creates this inflammatory response, which will put our hormones also out of balance, and create a kind of a imbalance in the entire digestion of the body, absorption of nutrients, and it will create immune cytokine storm kind of a situation where the body is not able to deal with this thing. So these are the kind of impacts you would have. It can go into your liver, it can go into your other organs, and it is basically a toxin. So your other organs are also going to struggle to remove it.
And I think inflammation today is the buzzword, right? Everybody, in
Yes,
fact, we get queries now in clinic asking us
yes,
to, prescribe a anti-inflammatory diet because there are some
yes,
celebrities who've endorsed it and have actually said that they've done this diet and they've lost weight.
yes.
There's a lot of buzz around it. And I think
So
this
let
is
me just add
important.
on here. It is also implicated in type 2 diabetes. It is also implicated in certain cancers, colorectal cancers, and it has also been associated with neurological diseases such as Alzheimer's and dementia. So you see, it has such far-reaching effects, which is why they say there is a direct connection between how you feel and how's your gut feeling.
Absolutely.
This is
And I
something
think,
very
as
real
they
about
say,
the
no,
gut.
yeah. It is a gut
Gut
feel
feeling.
that we say.
Yes,
Absolutely. And it's such an important thing, which we often neglect. And
yes,
over a period of time, I mean, the neglect starts in the beginning. And that's what we also tell a lot of our young clients and patients who come to us now, that this is the time, to actually build a healthy future for yourself. Because you may
yes,
not realize it now, but over a period of time, the kind of
yes,
lifestyle you're leading, the kind of food you're eating, because today you see the kind of food people eat, and it's
yes.
going to have an impact. And we are
It will.
seeing that,
It will.
right?
It will. It's a
Yeah.
progressive and kind of a cumulative effect that will be seen. So we need to start young with children in terms of what dietary choices they are making, and not, wait, because by the time you realize, there's a lot of damage that has been done, because inflammation is such a slow growing kind of a thing. It's not like fever that you'll catch like this and you'll go and, get some treatment done. It is such a slow thing. You'll have, bloating, and you'll have some one day a diarrhea, sometimes constipation, and kind of a pain in the stomach, and just not feeling too good, lethargy and fatigue. All these kind of things we don't really take into consideration when we are looking at gut. Actually, that's the problem. We are not really associating, brain fog and fatigue with gut.
Right.
So we
And it is
need to
doing
start
everything
looking at.
very topically. I mean, the sense you feel bloating, you just have, either medications or you would have some jeera soft pani, but you're not really
Ajwain,
treating the root. Yeah,
ajwain
or
gives.
ajwain,
Yes,
hing. I mean, all of that
yes,
keeps happening. And
yes,
constipation. I think leaky gut is another big problem that we
yes,
are seeing. We're seeing a lot of cases of IBS as well. And of course, like you
yes.
said, even the number of people with cancer, I mean, it has gone up
Yes,
drastically. And we're
colorectal
wondering what has
cancer.
really
My
changed.
God, colorectal cancer has boomed in our country. Really,
Absolutely.
it
I
is,
think
and I've
because,
seen doctors who've got colorectal cancer. It's so
yeah,
sad, you
yeah,
know.
because you see everybody's lifestyle. I think sometimes it's easy
You
to,
know,
to preach, but when it comes to practicing, Rohini, it's always a
mm,
challenge. I mean, all of us go through it, right? Because of the
yes,
travel, the kind of
yes,
lifestyle we have, the
yes,
stress we have.
stress. And
Look
then
at the
diet is the
stress.
first thing that goes out of sync when you're traveling or when you're
Absolutely.
working under very, difficult conditions where you don't get time to eat on time, or you're not having the right choice of foods. So all that really plays
Absolutely.
up, when you're talking about gut health.
Great. So thank you so much. And I think we'll discuss now in the next section that we have. So
Yes,
thank you, Rohini, and we'll meet again for the next section.
that looking
So
forward.